Welcome back to the channel. I want to talk about a study that's out now in JAMA Pediatrics that concerns me. Researchers had children during the height of COVID-19 pandemic line up outside 6 feet apart from each other when a dog that was trained to sniff for SARS-CoV-2 came up behind them and sniffed their ankles and feet. They weren't allowed to face the dog, and we're going to talk about that during this video. And this is how children were treated. Any child in whom the dog thought had COVID, the dog sat down. Later they test all the kids and they got to see how good is the dog. And I have no problem with people studying whether or not the dog can sniff COVID-19. What I have a problem with is doing this on school children in a school. That's what I have a problem with. So we're going to talk about that. I titled my Substack post, "Line Up Children, the COVID Sniffing Dog is Here to Judge You." Who thought this was a good idea? Who the hell thought this was a good idea? It's not a good idea. It shouldn't have been done in children. Unnecessary. Let's talk about this. So this is the photo that actually appears in the article. This is how the children were dehumanized and forced to line up and sniffed by this dog. The only time in my life I've ever been sniffed by a dog is in the airport, where I assume they're sniffing for bomb residue or drugs. I assume that's what the dog is doing, but I've never been asked to line up as a child and be sniffed like this. Moreover, this is the paper. Lessons learned from a COVID-19 dog screening pilot in California K-12 schools. I wish the lesson you learned was, don't do research on children that doesn't have to be done on children. That's the number one point. This research did not have to be done on children. You just need to get a bunch of people and have somebody sniff them and somebody swab them. And it could have been elderly people in a nursing home. You know who it could have been? It could have been doctors going to work in hospitals. In fact, I would have been happy to participate in the research. Adults, it's fair game. We can consent to all sorts of things. We're not forced to stand out in the playground and then have the dog mark those of us who are tainted with the pathogen in front of our peers and colleagues. I think that goes a little bit too far. You could have doctors do it. But what I think is really interesting is, in the entire pandemic, I worked in hospitals, many hospitals. In fact, I worked throughout the whole pandemic, in person, taking care of very vulnerable people. Not a single time was I swabbed asymptomatically. I was never tested when I didn't have symptoms. I never had a dog sniff me to see if I had COVID. What's my point here? My point here is, we are subjecting children to more restrictions than the doctor that's taking care of sick people. Ask yourself that. I'm an adult, at least. My risk of COVID-19 bad outcomes is pretty low because I'm a healthy young adult, but I'm taking care of the most vulnerable people. We're doing this in children who have the absolute lowest risk of bad COVID-19 outcomes. It was never any secret. It was known from day one. So we're doing the most draconian and, what I'm going to argue, dehumanizing interventions on the people who least need it. We didn't screen doctors, but we are screening children to go to school. That itself is crazy to me. But let's take a look at this paper, this research letter in JAMA Pediatrics. And I got a couple of problems with it, so let's talk. So we partnered with early alert canines to train 2 medical dogs. They show the picture of them in the supplement. I'm going to show that at the end because the dogs themselves, the dogs look cute. But what they're doing is actually kind of crazy. To identify volatile organic compounds emitted by people with COVID-19. This diagnostic study was approved as a public health surveillance, so by California State Committee for the Protection of Human Subjects. But one of the things about research is, if you can do the research with a less vulnerable population, you should always do that rather than a more vulnerable population. Children in school, I think, are a more vulnerable research population than doctors who can freely consent in healthcare settings. In fact, I think there are a lot of upsides to have done this in a healthcare setting, or nursing home, or even consenting adults. You didn't have to do it in kids. We're going to talk more. You're going to get to see why I feel that way. Electronic informed consent was obtained from participants or guardians. Was it coercive? Like, if you don't do this, you don't get to go to school? I think that kind of information would be very necessary to know to see if this was an ethical study. Early Alert Canine is accredited by Assistant Dogs International to ensure ethical oversight of the dogs. Well, I have no doubt the dogs are treated well. What I hope is that the children are treated better than the dogs. That's my concern of this paper. So let's take a look what they actually did here. Participants, that means the kids in K-12 schools, were made to stand 6 feet apart. I think it's outside from the photo. You be the judge of that. I'll show you the photo in a second. They're still wearing masks, by the way, even though they're outside standing 6 feet apart, which is another point to be made, that whoever's in charge of this doesn't seem to understand basics about how the virus spreads. The dogs, led by handlers, sniffed participants' ankles and feet. Dogs alerted handlers to potential COVID-19 infection by sitting To protect confidentiality, participants faced away from the dogs. So they couldn't look at the dog. They probably weren't allowed to pet the dog either, which is particularly cruel. And they had to face away. Whose confidentiality are we protecting here? I think what they mean is that the kid who's flagged with COVID, you don't want all the other kids to see that the dog has singled out this child. That may lead to some stigma. They may, be unhappy with that. They may be teased about it. They may be embarrassed. I mean, these are children we're talking about after all. So you don't want them to see that. But the thing you're not doing is you're not holding people's heads fixed facing forward. And as you'll see in the photo, it's so easy. And I know what I would have done, which is your kid in school, you're just going to look over to see what the dog is doing. You're going to sneak a peek. And so people, of course, will know which kids the dog is flagging as having COVID-19. Moreover, the dog has to sit, so the dog's gait is disturbed. So the person here, the dog is coming. All of a sudden, the dog's not coming anymore. You know the person to your left has been flagged for COVID-19. This is incredibly stigmatizing, okay? This is a problem. Who allowed them to do this on children when they could have done it, again, on adults, on nursing home patients, where this wouldn't be an issue? On consenting doctors going to the hospital. You could have done the same study. Doctors entering the hospital. You didn't have to do it on children. I really don't get it. I think it's a real violation of something here. We're going to write about this. I'm writing a letter to the editor for this. That's right. The first thing I'm going to do is write a letter to editor in JAMA Pediatrics. If you don't publish it, like you many times, these journal editors don't want to publish these letters. I'm going to be very up and unhappy with you. And I'm going to take it to Substack and YouTube. I don't need you anymore to get the message out there. That's the power you've lost, my friend. I'm going to complain about this because I think this is unethical, actually. I'm going to make my case. They're choosing to do this on children. They have the lowest risk of the virus. They never did it to doctors in California, okay? Doctors taking care of vulnerable patients. We didn't have to do this. We didn't even have to get tested. By the way, if we're asymptomatic, they also made them all do Binax too. So it's a simple study, which is you get thousands of kids and you get the dog sniffs them, who has COVID, who doesn't have COVID. Then you do the gold standard test, the Binax, and then you compare the results. You can calculate sensitivity, specificity, basic Epi 101 stuff that we teach in medical school. Maybe ethics should be something that we work on as well in medical school. We teach sensitivity, specificity, There are other things to teach too. Dog and antigen results were recorded in digital platform. This is the picture. And by the way, why is this picture in the supplement without the children's faces blurred out? That's another question I face. What are you doing, by the way, when you put this picture in the supplement? Okay, well, they're wearing a mask, so I guess nobody knows their identity. Although masks don't impede any type of human communication, of course not. That's crazy talk. No, of course they do. Of course they do. That's natural that they do. The dog has to sniff them like this. The dog sits down if they think they have COVID. I think it's pretty dehumanizing. I don't know about you. I think making children stand outside like this and having the dog sniff them when the dog sniffing you is the connotation is that you have narcotics on you or you literally have bomb residue and you're about to board a flight. And this is a country that is plagued by terrorist acts. I think this is a really sort of not a great message to be sending about a respiratory pathogen, which last I checked affected nearly all of these kids eventually. They would all get this respiratory virus because it's no fault of anybody to get sick with a respiratory virus that inevitably spreads. It's no fault of anybody to have that happen. So they're being stigmatized for getting sick, forced to stand in this dehumanizing way, sniffed. They're not allowed to look at the dog because that would break confidentiality. I'm sure they're not allowed to touch the dog or pet the dog. Working dogs, you're never allowed to pet them, even though some of them, they look pretty cute. They do. I mean, I want to pet some of them, but they're not allowed to. It's especially cruel. And the kids are going to look and see, oh my God, Tommy's been flagged by the dog. And then later, if, as we're going to come to, this dog not so accurate, then Tommy's back in school. You're like, I don't want to sit next to you, Tommy. I can imagine that there's going to be some emotional component to this, particularly when you go on very young children. This is the dog's performance, okay? Positive, negative, sensitivity 83, specificity 90%. Okay, let me just focus on one thing, the false positive rate. So the dog is shown on one axis, the dog screening result, the rapid antigen test on the other. And what it says is that the dogs are calling as positive 468 cases. In fact, the reality is of the 468 kids the dog has flagged, only 85 are actually positive. The dog has an incredibly high rate of calling out these kids. It's through the roof. The real positive rate is much lower than what the dog thinks. But here's the reality. The dog is sitting next to, marking 468 kids. Just 18% of the kids that are flagged by the dog actually have COVID-19. In fact, if the dog sits behind you, Who knows? Maybe in the next iteration they train the dog to just grab the kid and drag him out of the school. I don't know what they're going to do. I mean, who knows? These people, I don't know. They're not following any principles of medical ethics, in my opinion, which would be you don't need to do this on children. But what it's saying is that dog is stigmatizing 400 kids. Only 18% of them have COVID. Only 1 in 5 of the kids the dog is flagging have COVID. I don't know what to think. A lot more needs to be revealed about this protocol. If the dog flags a child, is that child taken out of line? Is that child kept away from the other kids? I suspect they might be doing something like that. Or is the child allowed to mingle with the other kids? Either way, they have a problem, I think, in terms of how they're running their study. Do the other kids know who the dog is singling out? The disease sniffing dog is marking who the dog thinks is a problem. I think you got a real problem. Most of the people are shamed for nothing, in my opinion. You're going to see the dogs, you're going to look over. We're all going to look over. We're kids in school. Come on, we're going to look over. We're going to see little Timmy has been flagged by the dog, and you're going to know that. There's no confidentiality, okay. The mask is over their mouth. It's not over their eyes. I mean, but maybe next time they'll want it over their eyes. I don't know these people. I don't know how they're thinking anymore. These are the 2 dogs. I'll grant that the dogs are cute. I mean, that's true. These are 2 cute dogs. They're not the best at sniffing, by the way, because their false positive rate is pretty damn high, if you ask me. I mean, maybe there's a different breed of dog. Somebody can put in the comments if there's a different breed of dog that is more accurate, maybe. What's my real take-home point here? My take-home point here is that this is, in my opinion, I'm joking a little bit because I do think it is a ridiculous study in so many ways, but it is messed up, actually, if we really think about it. I think it's something for the history books. How did people react to COVID-19? Well, of course, we closed the kids' schools. The history books will say those people were so stupid. They closed the kids' school. The only country that wasn't stupid was Sweden. They kept the schools open. They basically had no mitigation. The teachers did fine. The kids did fine. And in fact, their excess mortality rate a few years later was probably even better than most other countries. But most stupid countries closed school, which cost them a generation of talent. Of course, the kids didn't have upward mobility, which led to all these health decrements. It was clearly a stupid idea to do that, and there were people who told you it was a stupid idea, but because this one orange man wanted to reopen the schools and we knew everything he did was wrong, we just did the opposite. That's what smart people did back in the day. So we're going to conclude school closure stupid. Masking kids, I think pretty soon the majority of people are going to conclude that that is also pretty stupid because the CDC actually masked 2-year-olds with a cloth mask, except for when they nap in the same room. I was the one that brought that little anecdote to the mainstream discussion, which just proves how stupid they are and how stupid that policy. So that's going to be the next thing. But we also dehumanize these kids so much that when we wanted to train the dog to sniff out COVID, we made them all line up in the schoolyard and let the dog walk by them. We didn't do it in nursing home patients, people who places you might actually want to know where COVID is spreading. We did it in the lowest risk population you could possibly imagine, and the population that might actually have some stigma about the dog. And by the way, the dog was actually pretty bad at the job with a false positive rate, mostly false positive. The dog sat by you most of the time you didn't have COVID. Will the historians look back on this and say, those researchers, they're the real heroes? Or will they look back on it and say, that was pretty messed up? And I had my poll in my Substack, Line Up Children, this COVID sniffing dog is here to judge you. And 98% with thousands and thousands of votes and tens of thousands of people read the article, they conclude it was messed up. It was messed up. It's deranged. One of the things about dehumanization is actually that you don't see yourself dehumanizing. You don't think you're dehumanizing the kids. You make them stand out there in the outside wearing the useless cloth mask, standing 6 feet apart and having a dog sniff them when every connotation in Western society is that's associated with making bombs or carrying narcotics. That's the association. And you treat them like this, and you're not doing this for the people actually at risk. You actually probably don't even, you neglected the nursing homes, let's be honest. That's how the pandemic played out. You're doing this on children. You're dehumanizing them. And you're creating a situation that may lead to some stigma. The burden may be small. A few children may feel some emotional pain, but that burden is not justified because your research did not need to be conducted in children. So actually, from a ethical principle of medical ethics, the study is, in fact, in my opinion, unethical. It should not have been permitted to be conducted in children when a suitable, consentable population existed. You could have done it in prisons. You could have done it in hospitals. You could have done it in any adult setting where people could really consent or not consent, and where they weren't made to stand in front of their peers. I think back to when I was a child, I thought overall, very pleasant experience, but I do remember once when I was singled out by a teacher because I wouldn't sit in my chair. I remember how ashamed I felt. And to bring that on even one or two kids, in fact, you're bringing on many kids because the dog is sitting by 400 kids and the dog is mostly wrong. It's not good. Even if the dog were right, by the way, it would still not be good because kids shouldn't be singled out. But the dog is also pretty not good at this. But to be fair, let's be perfectly fair. How can one expect a dog to sniff out COVID-19 from your ankles outside in a breeze when your mouth is far away with a useless cloth mask over? That's not gonna. The cloth mask is not the dog's problem. The dog can easily sniff through the cloth mask. Oh, but that's actually an interesting thought. Actually, if the cloth mask was so good, how can the dog smell the compounds? Right? It should be catching them all. Right? Sure. It's a useless mask, obviously. Time you can read the Tom Jefferson report in Cochrane. I don't even want to bother with that. But it's messed up. I mean, it's messed up. It shows where people's minds are. It shows that their minds are in the gutter, that they think this is acceptable. And that is how dehumanization is. You dehumanize because you think justified or you don't see the humanity in what you're doing. Where else did we dehumanize? We didn't let people hold the hand of their father when their father died in the intensive care unit. I've gotten hundreds and hundreds of emails from people over the years lamenting that. That was a way we dehumanize people. There are some principles that are inviolable. I think the right to see a loved one when they die is inviolable. The right to meet a friend for coffee is inviolable. Free society should never intrude upon these rights. That's easy. And there are some things that also defy common sense. This defies common sense. And it's also ethically problematic. So if you agree, maybe the answer is to write a letter to the editor to JAMA Pediatrics, which is what I'm going to do. Actually, I'm going to write this letter. In fact, I've already asked the person I'm going to write it with to take first crack at drafting, because that's what happens when you're a professor. You have somebody else take first crack at drafting, but you're going to come and help. That's what I'm going to do. I'm going to help on this drafting. But I've already asked this person to take first crack. We're going to write in, and we're going to ask the important question, which is, why didn't the IRB, the ethics board, ask you why you needed to do this on children? What was the reason you couldn't do this on adults? And was there the potential to have emotional stigma attached to a highly inaccurate dog sniffing kids outside in the playground with the connotation that it's only done in the setting of bombs and narcotics? I mean, okay. All right. So those are my thoughts on this problematic, to say the least, study. The COVID sniffing dogs, the children lined up outside. The dog is cute, I'll grant him that, but you're not even allowed to look at the dog. Dehumanizing. It's not good. Reflects poorly on human brains being damaged. See, human brains were damaged by the COVID virus, not in the way many people think, with a direct viral invasion of neurons. That's unsupported. They were damaged because when people are afraid, they do stupid things. Exhibit A, they do really stupid things. All right, if you like this channel, you know what to do. Like, subscribe, comment, leave a message below. If you like this video, send it to a friend and colleague. Recommend this video, because I think the word has to get out. I think somebody has to draw attention to the fact that we screwed up with children, and the fact that this even made it through the editing process and nobody pointed out this has got a big problem with it speaks to the fact that children were treated worse than the dogs of this study throughout the pandemic. I really think that's true. They're treated so poorly, closing their schools, human rights violation, horrible, unthinkable human rights violation. As time goes on, I'm confident that every single person on this planet will come to regret the day they ever closed those goddamn schools. And I was one saying the whole time not to do that. All right, I'll be back later. Until next time.